Welcome back. We are talking about pressure injuries with Amy Lendy from Apple Rehab, who is a physical therapist with an emphasis on wound care. Thanks for joining us again, Amy.
Yes.
Let's talk about treatment. How are pressure injuries treated?
So the number one thing for treating pressure injuries is relieving the pressure, finding the source of it and finding ways to relieve that. Pressure injuries are treated with special wound care procedures that can be done at home if the injury is minor enough that the doctor or a nurse or even a wound care therapist would set up for you. Improving nutrition, making sure that the calorie intake is good and that the calories that you're bringing into the body are beneficial. They're full of the good nutrients that we need. Taking risks to prevent infections, making sure that the wounds aren't exposed to bacteria and other environmental hazards that could increase the wound size and create an infection.
If someone were taking care of a loved one at home and they thought, oh goodness, I think this is a pressure injury, is it a good idea for them to go ahead and treat it on their own, or is that a bad idea?
It really is always best if you go and seek medical attention for that, to not treat on your own, to make sure that the wound is getting properly dressed. There is a multitude of different dressings, and with all wounds, they need different environments to heal, and a doctor or wound care nurse can definitely help someone set up a better treatment at home.
If a person is in a nursing home or a hospital and they do have a pressure injury, who typically cares for that injury?
Yeah, so in those settings, there is care plans for folks that are either one at high risk for wounds or do have wounds, and it is up to the nursing team and sometimes in adjunct with the therapist to set up pressure relieving strategies, pressure relieving assistive devices. So it will be a combination of the doctors, nurses, and most likely therapists.
What should an individual keep in mind after a pressure injury has been assessed by a physician and now they're going to try and care for this individual?
So they really should be thinking about following what the doctor has prescribed for them, making sure that they are changing the bandages and cleaning the wound properly on time, and not substituting anything that the doctor did not prescribe, but also just helping this person relieve the pressure as much as possible. Look for other places in life that the wound might sustain some pressure and assist them with relieving that.
On average, how long does it take for a minor pressure injury to heal?
So a stage 1 pressure injury takes about 3 to 5 days to really, as long as the pressure has been removed. A stage 2 pressure injury can take anywhere from 3 days to up to 3 weeks. The important thing to remember is that if we don't get the pressure off, a stage 1 pressure injury or stage 2 injury can go further down the spectrum into a stage 3 or 4, which will increase the healing time.
Is surgery ever used in treating pressure injuries?
Yeah, so it's rare, but it can happen. So if you do end up with a pressure injury that is what we kind of consider that full thickness injury down to muscles, tendons, bones, there is surgeries that they can do to do a skin graft to assist with healing and getting new skin growth over the wound. There's also surgeries that they do to increase people's blood flow to allow more healing. So those that may have comorbid conditions such as the cardiac conditions or pulmonary conditions we discussed earlier, revascularization of an area may be needed.
I've read about, obviously, infections and pressure injuries. Is sepsis a concern with pressure injuries?
Sepsis is a concern with pressure injuries. Anytime we have an infection that goes uncontrolled or unchecked in our body can result in a full body infection. Important thing is that people are looking for causes of infections. Is the wound or the side sore? Is it red around the wound? Is it growing? Do they have a fever? What kind of drainage is coming out of the wound, especially if the drainage is yellow or greenish color, and also looking for dying tissue around and near the wound. So it's any of that tissue that's kind of looking black or that kind of brownish tan can be a sign of infection.
So if an individual, a caregiver, sees that sign, they should seek immediate attention by a professional.
Yeah, you should. And if someone was ever to have a fever and have a change in mental alteration, it's important that you would get them to an emergency room and instead of waiting the next day for a doctor. So it's important to look at other signs and symptoms of what might be going on in our body that could lead to a serious event.
So if I have a friend who is in the nursing home and I am visiting and I observe something that looks like a pressure injury, what should I tell the nurse? What should I do?
So it's always best to speak up and talk to the nurse and the care team, but it is important to note that there is federal laws and regulations that they may not be able to share that information with you if you are a friend, that you may have to have legal medical power of attorney or the permission of your friend or patient to discuss that with. But it is always important to, all bandages and dressing changes, they should be initialed and dated, and there should be the availability to ask, how often is this? So if they say, well, we change the bandages every 3 days, and if you look and that bandage isn't changed, you should speak up. It doesn't mean that they're, not being well cared for. It may have been, maybe a miscommunication. One shift was asking the next to do it. So just being there and being an advocate for loved ones is a great thing.
We just need to speak up and be that advocate for sure.
Yeah,
absolutely. Good. All right. Thank you, Amy, for that great information, and thank you, our viewers, for watching. See you next week. In the meantime, stay fit, stay well, and stay healthy for life, with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.